The second misconception that we commonly hear is with relation to either early inductions or an elective, sometimes an elective cesarean section, is that the fluid levels have dropped. Now, fact of the matter is we honestly don't know how much fluid that particular mother has been carrying throughout her pregnancy. So there are averages, and there is averages in the first trimester and second and towards the end. But really to say that which mother has carried how much, some women carry fluid at the lower ends of normal throughout the pregnancy, some women carry it at the higher ends of normal, and most people go somewhere in between. But to say again that this woman, just because I am seeing an XYZ fluid level of this particular mother at the end of pregnancy, I am going to label it as low fluid and I am going to do interventions based upon that, seems to be something that we need to rethink about, simply because one thing that we do know is that at the end of pregnancy fluid levels do drop. If the fluid levels remained high, baby would be floating somewhere, would not be able to make its way into the pelvis. So there is a natural drop of fluid levels towards the end of pregnancy. The other component is that why are we worried about these fluid levels? Typically the worry for the practitioner is that okay, if this fluid level drops a lot, then during labor, maybe as the compression happen, as the uterus contracts around the baby, it might compress the cord, leading to maybe stresses on the baby. But again, without labor starting, how do we know? So in practice, we find sometimes babies being born with teaspoonfuls of fluid, and they have done perfectly well throughout labor. There are other times when we find when the bag of waters breaks that there is a fountain of fluid, and those babies also do well. And somewhere in between fall most mothers and babies. But to again put a time frame on it and put a fluid level on it and say, boy, you're carrying less fluid, therefore I need to either induce you early or I need to do an elective cesarean section, without again letting the labor start and letting us assess how the baby is tolerating that process of labor, does not seem to make sense. There are other parameters that you can see. How is the Doppler parameters? How are the biophysical profile? There are many things you can assess without just the fluid level being given as the only indication for going in for interventions in cesarean sections.